questions that you guys might have along the way. Jump into the system, show you how you can use it both publicly and for internal communication on a daily basis. And kind of wrap up by talking cost. Don't worry about taking too many notes. I will get Jeff and Sheriff a copy of this presentation that we review today. So if one of the two of you doesn't mind distributing that to the rest of the group today.
You bet.
And, let's keep it very informal. It's just me on this end, so if you guys have any questions or anything, fire them off whenever they come to mind, and I'll do my best to get them answered. If one of you wouldn't mind kind of catching me up to speed a little bit with what's going on in the county, do you guys have any type of mass communication in place, or is this something you're just starting to dig into?
This is something we're just starting to dig into. However, we have a website that people can access for information, but real-time data or information that we want to put out, we're kind of behind the eight ball on that.
Okay. Now, you said you've got a website. Are you doing anything with social media at all?
No.
Okay. Tell me a little bit about internal comm. When you guys are mobilizing and dispatching your people, how do you go about that process?
Well, from the sheriff's office standpoint, it's over the police radio or it's cell phones.
When you're doing the cell phone, are you calling them or just sending them a text?
Some of both, but primarily by calling.
And are the majority of your personnel there, specifically at the sheriff's department, are they using smartphones or?
Yes, they are now. No, they're using smartphones as of the last 6 months, I guess.
Okay, good. Last question. Just general reception throughout the county as far as your cell phone coverage, what's it look like?
It's actually pretty good.
So you're doing better than most of the folks I talk to in Iowa.
Well, we do better than most folks in Mitchell County.
All right, well, I'll put bugging you. I appreciate the information. It just gives me a little bit better direction on where to take it today.
Sure.
Just to kind of get started, give you guys a little bit of a background on who we are as a company and what we do. Inspiron was started back in 2003. We work solely in emergency communication and internal day-to-day communication. The product's name is WENS, Wireless Emergency Notification System. With WENS, we really focus our efforts from a sales standpoint on three core markets: education, healthcare, and then obviously government agencies such as your county. One of the biggest benefits to utilizing our product is the fact that we sell this system as a county or a regional system. In your case, obviously a county. And you have the ability to use this in any government agency you choose throughout the county. It's not one of these systems where you're using it solely for emergency communication. It can be used, like I said, to mobilize your personnel. It can be used for something a little bit more simple, like trash collection day or parking bans. So it's not, you'll see when you start evaluating the industry, some of these systems say you can use it only for emergencies. And you have different rates and different charges if you use it for just day-to-day activities. And both from a data and a cost standpoint, this is extremely significant. Obviously, from a cost standpoint, it doesn't make sense to Mitchell County to have the schools with a system, the sheriff's department with a system, your fire, your maybe police, EMS. So what we're trying to do is streamline communication throughout the county and utilize one system for all your internal and external needs. At the same time, you're capturing more data of your community, more information about your public, building a database to be able to reach out to them in those true emergency situations. So we always say start with your schools. I'm sure they have a system in place currently. I can almost guarantee you we'll be able to reduce their cost, give them more functionality by partnering up with you guys at the county level. Look at things like your public health department, hospitals, med centers, clinics. Usually a relationship is, one of the first relationships I see are with the local utility companies. Public, private owned, doesn't matter. It's a great source of data, and they typically have a little money money to throw at something like this. Our core market since about 04, 05 has been government agencies. Like I say, we are typically selling it as a county or a regional system. I've got some very small towns and villages utilizing it. It's a very scalable product. We've also go through a review on an annual basis by the Department of Defense. We represent Camp Pendleton, largest Marine Corps base in the country. They have to evaluate this industry annually to make sure they're getting the best bang for their buck, basically. And we're now going on the 5th. Here in 2014, it'll be the 6th-year renewal with Pendleton. There in your state, we do have quite the presence. A lot of your counties throughout the state are starting to migrate to our program. We have a very good relationship with your Emergency Management Homeland Security Department. We'll get into it once we get into pricing, but we are hoping to be the state provider of this solution. We were hoping to have it done last July was the goal. Now the word is that they're going to be going out for bid again here within the month of November. We're just kind of sitting back and waiting for it to happen. So that could be a 6-month process. It could be a year. Who knows? We get the pricing. We'll talk about some things we've done specifically for the state of Iowa to help get a system in place but not lose a lot of money on it. Currently, we are doing business with everybody from your neighbor, Worth County. You head a little bit further south, Johnson, Cedar, Lynn, Buena Vista, Washington. The list goes on. We do a very good representation throughout the state. When we start wrapping up today, if you guys would like to speak to any of our current clients within Iowa, just let me know and I'll get you their contact information. Getting into the system. Let's talk for a couple minutes about mediums, ways to communicate. We're really going to hit the entire spectrum. You're looking at everything from voice calling, landline, cell phone, with an actual voice call, SMS text, email, alphanumeric paging, and then we get into the unique. We are fully integrated with the IPAWS program. I'm sure you guys have been getting hit pretty hard by FEMA with information regarding it. We have tested our product with FEMA. We actually have a point of contact up there, Gary Ham, that's been working with us, not only to be able to facilitate information to your community, but also for your community to be able to reach out to FEMA in an emergency situation. Very similar integration would be that of NOAA. We have a full integration with NOAA. We send out automated weather alerts on behalf of the county. We'll dive into that in a little more detail as we go forward. We give you desktop alerts, which is generally a big plus for those K-12 schools and really any government building in the county. It gives you the ability, should you need to lock down a facility, maybe evacuate a government building, you can send a pop-up notification to every computer screen in that specific building alone. It's kind of similar to a weather bug in your computer if you've ever used one of those. We have integration with everything from CAD to Facebook to Twitter. You said you weren't using social media currently. I'm personally not a huge fan of it. I've had to learn to respect it professionally. We can even set up a Facebook and Twitter account for you. That way, whether it's an automated weather, automated IPAWS, or you guys put out an alert, it'll just automatically post it to your Facebook and Twitter account. So we highly encourage you start using it. I don't know if it's a good or a bad thing, but that's a lot of people's sole source of information today. Then we do give you picture and video sharing as well. We're the only company in the industry to offer it. It gives your employees that are carrying those smartphones the ability to take pictures and videos from the field and relay them out to other agencies or their own employees. Now, maybe the sheriff's department's got a sketch of a suspect or a picture of a vehicle. They can send it out to the cell phones of everybody actively on duty in real time. So it's just another way to communicate, but now you're getting that picture or video as well. With respect to the system, it is solely web-based. Some call it software as a service. There is no physical equipment sitting anywhere within your county or within your state. You can access us from any computer with internet access. Doesn't matter where you are. Unlike today, Jeff had to probably do a couple downloads and add-ons to get into this WebEx meeting so we could share desktops. Some systems follow in that path, where if you're at a foreign computer, if you will, you have to download, do a couple add-ons to be able to access the system. With WENS, you simply jump on through any browser, go to our secure site, and log in. So it's very quick, very effective. In addition, anybody using a Droid or an iProduct, an iPhone, we have administration apps. So you can just go to the store, download the app for no charge. You've got full system capabilities in that condensed administration app. You can access us from the mobile browser, which is typically preferred on your tablets or your phones at any time, anywhere. And you can call us 24 hours a day. At our corporate headquarters here in Ohio, we can initiate an alert on your behalf. So accessibility to the system, anywhere, anytime. I'm not going to waste a whole lot of your time and get into every medium. I typically do like to touch on the core mediums, which are typically still voice and text. We're talking a couple years down the road, we might be talking text and social media and email. We're seeing a huge decrease in the landlines throughout the country. In your state, we are still seeing the majority are doing a data dump of their 911 information. Obviously, that's predicated on voice communication. When you're dealing with voice, it's pretty straightforward. You're looking at cost, you're looking at location of the system. In years past, the only thing you had available to you was typically referred to as reverse 911, where you were purchasing physical equipment to sit somewhere in Mitchell County. Today's day and age, we get it out of your local infrastructure, we increase your speed or throughput. And we reduce the cost significantly because you're not paying for updates on that equipment. There's no landlines needed locally going in or out of that building to facilitate the communication. Pretty straightforward. Now, I'm not sure if the room's familiar. If you are, I won't waste your time, but I guess somebody can answer. Are you guys familiar with the difference between SMTP and SMS when it comes to text messaging?
I don't think the room is.
Okay. We're going to hit it because it's probably the most important topic we're going to cover today. When you're discussing text messaging, there's two polar opposite ways to facilitate a text. Many of my big competitors in the industry are still using this column on the left labeled SMTP. Stands for Simple Mail Transfer Protocol. The acronym's really not that important. Here's what is. You're not sending a text message. You're sending an email made to look like a text message. A lot of CAD providers will do this. Basically what it is a 10-digit phone number at Verizon.com or at AT&T.com. Well, the problem with that is you're sending these large groups of emails into cyberspace and basically hoping that they hit your resident or your employee. But there's no time and date stamping whatsoever. When you're dealing with email, it's shoot it into cyberspace, hope for the best. It's not a bi-directional form of communication. I always look at this SMTP or email-based approach as a one-way street. You can send information outbound all day long to your residents, your employees, what have you. But you can't get responses back. So you cannot use it for any form of dispatching because you can send a message to your employee base, but they can't respond to you, letting you know if they can take that shift or, go out on that call. It works in the same way with delivery receipts. You send a message out in this fashion, it's not going through the major cell phone carriers' network, so they can't time and date stamp it. So I really look at it more of a mass notifier than anything. Now, SMS, or short message service, is commonly referred to as true texting. It's more of a point A to point B situation. There's no email involved. And the biggest perk here is it's bi-directional communication. So if you send a message out to 10 of your employees at the Sheriff's Department, they can all respond back to you. And I'll show you how that works in the system. Not only can they respond, but every message you send outbound or that comes into the system will have a time and date stamp specifically from their cell phone carrier. So you know exactly how long it took to hit everybody in your community. You know exactly when your employees received a communication. So it's really about accountability. There are your major differences. To be right up front, the reason companies use SMTP, it's free. I could set up a system out of my basement and send messages all day long and not incur a single charge. Where SMS, you've got throughputs, you've got provisioning with the carriers, and quite frankly, it's a little more expensive because of its reliability. We get these things out at a rate of 120 messages per second. So you can see how quickly we could hit the entire county if we need to. Let me hit pause for a second. Are there any questions, anything I can go into more detail with respect to texting?
Doesn't look like there's any questions.
Well, I'm here in silence. I'm going to keep moving. Bottom line, when you're evaluating systems, the question is not, do you send text? It's how are you sending your text? Are they going out through SMTP or SMS is your reality? That's the question you want to ask. Let's jump ahead a little bit. I want to talk about the biggest pain point in the industry. Doesn't matter if you're talking to me or you're talking to any other vendor, the biggest pain point in this industry is getting participation out of your residents. This really all starts with our pricing structure. The fact that we allow you to use this throughout every facet of your county. That alone is going to get you more participation, more word of mouth going, familiarity with this system. You know, like I said at the beginning, your school's got emergency contact data. Utilities got great residential data. These are all things that we can import in the system for you as often as you like. And you look at other options like your 911 data, send that to us as often as it's updated. We will dump it in the system, keep it clean. There's never any charge for those imports. And then we see relationships with everything from nonprofit organizations to church groups to help get the word out on this type of product. So basically, you're knocking out your public information with the 911 data, possibly schools, possibly utilities. And then everything else with the privacy issue, we need to market it to your community. So we're going to do press releases, media blitzes, get it out to the local community, let them know how to participate. It's another reason why I kind of push the social media as well. It's just another way to get the word out there to your residents, direct them to your website to get them to sign up to receive information. Let's get out of this presentation for a second. If you take a look here at Bay County up in Michigan, they seem like minor details, but they're significantly important. Most companies are going to give you a cookie cutter registry page, meaning they all look the same, they capture the same basic information, name, address, means of contact. They're going to put a big link somewhere here on your website so people can click on it. It redirects them back to their corporate website to sign up. Today's day and age of little faith in corporate America, it will keep your subscription rate lower. If you notice with Bay County, we actually embedded the registry page directly in their website. So if you look at their URL, you're not seeing Inspiron or WENS. In this case, you're seeing Bay County. Then, what we encourage, use the links or banners on every website you can in your county. Any businesses, schools, libraries, like I say, nonprofit organizations. All we're trying to do is redirect as much traffic as possible back to your county website for people to sign up. And then this is an evolving and a customizable process. Your registry page will probably look starkly different from one year to the next. As you get more agencies involved, you can give more options to your community. So if we look here, Bay County has a little blurb discussing what the system's about. They capture first, last name, and multiple means of communication, so somebody can sign up themselves or their whole family. And they've only got a couple options here. Road closing, seasonal preparedness. They capture a physical address for the mapping and the automated weather. And they ask the residents, do you want weather alerts, yes or no? Pretty simple. You can go the route of Charles City County over in Virginia. They did a much better job. They got really their whole community involved in this registry page. Same concept, information, names, numbers. And then they broke it into various types of alerts. So when a resident signs up, they're automatically getting emergency communication from the county. But then they're telling you the additional type of information they have interest in. So you're not desensitizing them or annoying them, quite frankly. They're telling you the type of information they want to receive. So if you look here, they have a very open door government policy. The resident wants information, just general information from the sheriff's office, maybe one or two of their local representatives, they can select it. They got public works involved. The resident might want to identify where they live and where they work for service interruptions and outages. I love this aspect. We've identified that special needs information is very lacking throughout this country. So they got involved with their public health department, build out a special needs registry. So now an individual or maybe one of their family members has a special need, they can identify it. So now public health and your various institutions can reach out to them for events and information purposes. But quite frankly, where I see this used most often, I'm typically working with law enforcement, fire, and emergency management. This just becomes part of your day-to-day, to where if maybe your sheriff's department, maybe a local fire department is dispatched to a property, you have access to your data within our system, which is very uncommon. So you're called out to a property, search them by name or address, and you can identify if somebody at that property has a special need that your personnel needs to be aware of. So it's just giving you more information before you send your personnel to a doorstep. Instead of saying, do you want weather, yes or no, let them pick and choose the various weather alerts they want to receive. Some of our accounts will have these as defaults, so they'll say, well, you're automatically going to get these 4 alerts. If you want anything additional, same thing, got to have the physical address for the mapping alerts. And then this is really caught on throughout the country. It's kind of just a free type or a catch-all. So any information a resident feels like your core personnel in the county needs to be aware of, they can just type it in the box. It becomes part of their account. Family members, property info, what have you. Once they hit sign up now, they're pushed based off their selections into the appropriate group or subgroup within the system, and they're ready to receive information instantly. Any questions on customization, getting people into the system, anything we've talked about here real briefly, guys?
Ray Huffel, an emergency management coordinator, on that information about special needs, that only goes into certain people, but it's not for the public, am I correct?
That's absolutely correct. When you're with our system, it is unlimited administration. So you're not limited to just a few people that can see the information. The county basically can hand out administrative rights, usernames and passwords to the system to whoever they see fit. And the county is determining what they can and cannot see. So if you give it to maybe a K-12 school or maybe the fire department, if you don't want them to have access to any portion of the system, you just don't give them rights to it. Did that answer your question?
Yes, it did. I'm the coordinator for Worth County as well, where we have this system.
Okay.
And a few weeks ago, we did a disaster drill in the town of Bertle. And we used this system to tell the people, alert the system for the people. And we had one family that the resident was on oxygen, which was very beneficial to the first responders.
I see what you're saying. Okay. So now at Worth, have you guys started to build this out, or is this something that's new?
It's up and in operation.
Okay, good. When we get you in the system, I'll spend some time within the administrative capabilities just so everybody can see how they can be broken down and what's visible to which employees. whether it's about information in the system or anything at all. Is there anything else that we can address?
No other questions?
Moving forward, let's take a look at a couple of these functionalities real quickly, and then we will jump you into the system. We are fully integrated with Nov. The major difference here, this is not an additional fee. It is included in your annual fee. And it is a full integration. The way this works is we are basically going to give you a pick list of every optional weather alert that's available for your county. You then set them up according to the needs of Mitchell County. So for example, you might say, you know what, there are only 10 alerts we want to go out to the public. My first responders, my core personnel, I want them to receive everything that comes through the county. I want to narrow that down to just 10 for the general public. You know, I'm sure many in the room are familiar with no alerts. You turn them on full-blown to John Q. Public, they're going to get annoyed. Too much information. Or at least desensitized to it and quit paying attention to what you're sending. So if we go back to that example, you could say, you know what, I want 4 of the weather alerts going out 24 hours a day. Everybody's got to know about it. The remaining 6, you might only want issued from 7 a.m. to 9 p.m. You're not getting people out of bed with a thunderstorm at 3 in the morning. So you structure them, we push them out for you. Next, you got your desktops. I always tell people it's not a primary form of communication, and I encourage all of my accounts to get it installed at every government building in the county. Hope you don't ever use it. If you did need to lock down a building, you did need to evacuate, you could put a pop-up alert on the foreground of each person's computer station within that building. Not only do you get the visual, as you can see here, the speaker system's turned on, it'll verbally repeat that alert as well. You got your picture video sharing. It's really just starting to catch on over the last couple of years. More and more agencies are wanting to see the pictures and videos, especially now that people are carrying smartphones daily. Might as well leverage that technology. You know, we discussed briefly a law enforcement example. You know, whether it's a picture of a suspect that's at the department, maybe you've got a traffic cam, a photo, whatever the case may be, you can send that information directly from your department out to only the people who are on duty in real time. We see it used in departmental communication. More and more we're hearing that our ambulance services throughout the country, that local ER wants to know how the patient was impacted. So they can take a picture or video on scene, send it to the ER before that patient even hits the door. And hands down, in my opinion, the most useful application here is with Amber Alerts. You get a missing child or even a missing senior citizen, you could send a text and an email to everybody registered within the county, within a specific city even, with a graphic of that missing individual. All they have to do is hit reply, and they can send any information right back into that department that they have on the whereabouts. So, pretty proactive tool here when working with the community. And you've got your mapping. The GIS mapping gives you the ability to pull up a map of the county and target specific areas, whether that be a shapefile, whether it be a radius. And I'll just get you in the system, we'll show you how that works. Here's where we're going to log in. Just go to our secure site, type in your username and password. Biggest differentiator here with the industry is the fact that we give you unlimited admin. Most companies are going to give you 3 to 5 administrative rights, so 3 to 5 people in the entire county that can use this thing. And then anything above that 3 to 5, they sell you on an annual basis. So many companies are actually making their money selling you licenses as opposed to the system itself. It get quite costly. With ours, it's truly unlimited. Structure it however you want, set up as many employees as you desire within the system. You just jump on from any computer, tablet, mobile device, log in. It's going to pull up the WENS interface, or console as it's usually referred to. All of your controls are on the left-hand side. We'll just start here at the top, work our way south. Your one-time alert screens where you're going to send out the majority of your information. You always have the ability to say, yes, I want to hit all public. You got a true emergency, it's affecting the whole county. Just click yes, you got everybody. More often you're going to say no, and you've got an unlimited amount of groups and subgroups that you can segment your communities into, as well as your internal departments. If you look at an example like the city of Green here, maybe you don't want to waste your time getting out a map and sectioning off borders, you can just click here, send a message to everybody within the city of Green. Or you can say, no, I don't really want to get the residents involved yet, but I do need to let their police and fire know what's going on. Just internal communication. Or if you look at like a fire department, it's a good example. You can click there and say, yeah, we need to mobilize our fire department. Send a message out just to your employees, wait for a response, see who can attend that shift or that event. Or you might say, no, I don't want to mobilize everybody, I just wanted to hit station 2 and 3. If you're dealing with smaller agencies, you might want to list this fire department here as your primary. And then list off every fireman by name so you can do small group communication just to those individuals. So you structure these however you see fit. After you decide who's getting the information, you select how you want them to receive it. Voice, text, email, maybe everything at one time. You can default those however you see fit. Type your message into the text box. Anything you type into that box will instantly be converted through text-to-speech to hit your voice mediums. Your cell phones, your landlines with an actual voice call. Simultaneously, every other medium is getting exactly what you typed into that box. So you're not jumping into multiple screens, you're not logging into Facebook and Twitter, it's all done simultaneously. If you desire, you can also upload an audio file. So you do not want to use the text-to-speech, some refer to it as robo-voice. You can actually record your own voice on your computer and upload the file. Once you upload the audio file, you hit send. Your voice calls are getting your recorded voice. Everything else is still getting what's typed in the box. So best of both worlds. If something more specific happens, get rid of your group subgroups, use the mapping tab. If you're using it more for dispatch purposes, you might want to type in an address and let it pinpoint you. Type in my corporate address. It'll take you directly to that location. Work from there. Or you can just go into it, use your shape tools on the left-hand side. Hone in on a specific area within the community. You have the standard map. You got the satellite imagery if you really need to get into a neighborhood possibly. And you have the hybrid, which is the street overlays as well. So if you look here, maybe you've got a hazmat situation, maybe you've got a bridge closed, whatever the case may be. You click on your radius, input your mileage, just say half a mile, and drop your pinpoint. Now all you're doing is saying, yep, want to hit all public just within this radius set. Type up your message, hit send. That message is out the door across all mediums to everybody within that radius. You want to get more specific, typically your utility companies will use it. You can even take it down to the street level and do a shapefile. Say, well, we got a boil order, but we only want to notify this part of the community. Draw it out, close it off, hit send. You also have an unlimited amount of prepared alerts, which are just that. It's scenario planning, it's common occurrences. You always have the ability to touch these off from your mobile device in the field. So you can just hit send to trigger them off. Elevated flood zones, problematic areas, you name. These, if I take you into one, you'll see, these can be based off of your group subgroups, or you can save a shapefile for future use. Your personnel aren't plotting them off on the fly real quick. I often see a lot of our utility companies will section off their different districts and zones. So if one of those areas is affected, they can just update the message and send it out. They don't have to replot the borders again. We also see these used on a regular basis for future one-time alerts. A lot of times our entities will set up every day their offices are closed. Local communities will use it to remind the public of events and festivals, fairs going on. But they're just that, future one-time only alerts. And then you also have reoccurring alerts, where if you've got daily, weekly, or monthly events, whether it's testing or LEPC meetings, what have you, you can set them up to go out at a specific time and date, once a week, once a month. Just automates the process. Information. Another one of those, make sure you ask questions. The majority of our competitors, not only do they own the data, it's clearly stated in their contracts, when somebody signs up from your community, that data now belongs to that company. We are housing your data. That's it. You own it. And it's searchable. Some of my biggest competitors, pretty familiar in your state, have actually gone to Xing out phone numbers so you can't even take screenshots. With ours, we want you using it daily. Whether you're looking up an employee, whether you're dispatched to a home and you're typing in their name or address, all you have to do is type in your search credentials, and it'll identify anybody associated, as you can see here. So whether that's the employee you're looking for, or maybe that's the home that you've just been dispatched to, you click on the phone number, it pulls up any of their personal information that you might have. Name, address, if there's any special needs information. You'll notice down here at the bottom there's even a description field. A lot of times we see our departments using this in conjunction. You know, maybe your sheriff's department was at this property a year ago and they identified a vicious dog. After the event, add it to the system. 6 months later, a fire department shows up at that property, they know what to expect. Seeing more and more of our agencies, especially law enforcement, will update, a common drug house or a problematic area. Just so, emergency medical services show up there one day, they got a better idea of what they're going to step into. You can also send messages to the individual user from here, whether it's an employee or the public. You want to get more involved? You can go back out to your group and subgroup section and do an advanced search. You want to generate a report of everybody in a village, everybody in a town. You can set up reports with as many fields as you want and order them however you see fit. Or you can go in over here on the right, which is your groups and subgroups. And let's just say for a second that this layman group is your sheriff's department. You identify any group or subgroup, you do a search, it'll funnel through the system and generate a departmental roster. There's everybody in that department, or that city, or that town, whatever data you're looking for. In this case, if you said, well, I wanted to communicate with this department, but I only wanted to hit Anderson, Lehman, and Randall's. Just pick the employees you need to communicate with, click Add to Temporary Group. All that's going to do is extract those 3 people from that list and put them in a one-time only distribution list out at your home screen. Right there they are. Select them. Tell them when and where to report for duty. Hit send. Very easy way to mobilize your people. Do we have any questions or anything I can go into more detail before we start looking at recording and alert logs?
No questions.
You guys are being way too easy on me today.
We're not done yet.
Here's your alert log. This is a detailed breakdown of every message you've ever sent historically. Again, this can all be sectioned off based off administrative rights. If you do not want the schools to see what your fire department's doing internally, don't give them rights to it. So if you look down here, it's just a one-by-one breakdown of every alert, whether it was an automated weather, automated iPause, or you guys sent it out manually. Let me get you a good example here. Now if you look at this one, looks like I sent this out a little over a year ago, probably doing some training of a new employee, but it'll get the point across well. Everything I highlighted in blue is just a quick snapshot or an overview of that message. It tells you what was said. It tells you the type of alert, the mediums used to facilitate the message. It will, I'm the only one using this system, so you're seeing admin, but it will say the first and last name of the employee that hit the button to send it for your accountability. Now, if you really want to do some homework, maybe you sent this out to a couple hundred people somewhere within the community. As soon as you send that alert, you can say view every text, voice, email, or page. If you said view text, excuse me, it's going to break down for you out of that overall alert. It's going to show you each person you sent a text message to, one by one. Again, you can structure these reports however you want. If you want more fields, more information, that's up to you. We automatically detect the carrier because we're using SMS. It tells you when your personnel hit the button to send it, down to the second, based off those time and date delivery receipts from their carrier, when it was received by their phone. And obviously you're going to get these. Delivery failures. There's no company in the industry that's going to be able to deliver every message you send. If somebody doesn't pay their phone bill, we can't get them a message. But we are going to identify them. So let's say that you did have, whether it's a hostage situation, maybe a structure fire, you send it out to a small group. As soon as you do so, you can say, hey, show me every failure. Search it. It'll generate a list of just the messages that failed. If you've got the manpower to do it, you click on the number. If you have all their personal information, you can forward it out to your people already in the field. Let them swing by the property. You even click on it and send a message to an alternate form of communication just to see if you can get something through to them. If we look at that same message on an internal standpoint, which is actually what it was designed for, the verbiage here reads, additional emergency personnel needed Wednesday, October 24th, 3 p.m. Please reply yes or no. Maybe you sent that out to a group of employees for an overtime shift. Maybe you needed to activate a local fire department, whatever the case may be. As soon as you send the alert, you identify it, you say view replies. And it's going to break down for you each employee, time and date stamp them, and show you exactly what they had to say. And it's got a smart aleck in every group. Let's say we'll use that overtime example. All right, first four to respond yes, got the job. Right there they are. Again, add them to a temporary group, send them a message, tell them when to report. Heck of a lot easier than tracking them down or the old phone tree method. A couple things I like to touch on with account settings. Most companies want you to market their product. On the website, through your marketing communications, they want their name all over the thing. We'll fight you tooth and nail not to do it. You know, we've got a very good presence in the state of Iowa, second only to Ohio. But the reality of it is not many residents are going to know what a WENS is. They do know what Mitchell alerts are, or county alerts. So when we're doing your press releases and media blitzes, people are familiar with the concept. They know what you're talking about. Same thing goes, probably more importantly, your caller IDs and your emails. When we put out an alert via voice, you can set up a caller ID for every separate department if you choose. So when it's coming from the sheriff's department, people will know that. Same thing with your email. It's not going to come from Inspiron Logistics like you can see here. It can originate from any email address that you choose. Just name branding it for the county. Going back to one of the first questions we had, here's your administration. already, mentioned a million times by now, it is unlimited. I've got 4 set up here. You could have 4,000. It's up to you. You go in, you say add administrator. It's going to just give you a blank template. Whoever your leader and master administrator for the county would go in, set up an employee. We'll just use me as an example. Learn how to type a little better. Give them a username, give them a password. Now you have to decide in this example what Steve Lehman can do with the county system. So you might say, no, I don't want him changing, deleting, or manipulating anything. No. No, definitely don't want this guy sending messages to the whole county. But let's let him send messages to certain areas or certain departments only. Yes. You pick and choose any of the historic information that this individual is able to see. So you can say, well, he supervises Chris and Rick. I don't want him to see what these other 2 are doing. There's your list of prepared alerts. You can say, well, this guy, I want to be able to send out power outages and gas leaks, but nothing else. They're the only 2 they'll be able to activate. Set up their own email and customizable caller ID. And then pick and choose who they're able to communicate and what they're able to see. Say, well, this guy works at the city of Peoria, volunteers on Station 3, and sits on that mayor's city council. When you hit create and this individual logs in, they cannot see any of these other groups or subgroups. Like having a standalone system. They can only have access to those 3 that you've given them authorization to. Down the road, they get more, get a promotion, they get more responsibility. You can add them at any time to their profile. The other thing I want to talk about quickly is keywords. I'm sure many of you have seen these in some capacity. If any of you are a professional sports fan, I know you've seen them. So where you go to a professional game or you go to their website, you'll see, I'll use the Browns. Unfortunately, I'm stuck being a Browns fan here in Cleveland. But they'll say, hey, if you want information on scores, players, updates, text the word Brown to this 5-digit number, and you automatically start receiving text from the organization. Same thing for emergency notification. You can have them text the word Mitchell into the system to just receive general emergency information via text from the county. You set up a separate keyword for every city, town, village throughout the county. It's just a way to get people to participate that maybe they've got a cell phone, but they don't have a computer. And let's face it, they're too lazy to go sign up. You can do it from their breakfast table after reading the press release. So just another way to get people involved in the program. I'm going to tell you, as a pretty brief overview, that's really what I wanted to show you. What questions do you guys have? Are there any scenarios that I could run you through at this point while I got you in the system?
Yeah, we do have a question for you. Here it comes.
Go for it.
Have you ever had any administrators abuse their access to all this information in a way, like maybe they had somebody they had a romantic dispute with and they were an administrator and they used that ability to do something? In your experience, has that ever happened?
In my experience, no. And the reason is you have the ability to tailor down this administration. I mean, you could make somebody an administrator of the system, but only give them access to a small group of people, like a CERT team, for example. So the only thing they would be able to do in the system is go into the system, log in, and send messages to that CERT team, but they have access to no other portion of the system. So as long as the government body, as long as the county or the city is structuring administrative capabilities right, I've never seen it as an issue. I mean, the reality of it is, if your lead administrator of the system decides that they want to go loopy and send a message to everybody in the county, they got access to it, they could do it. But we haven't seen it happen. Yeah, I would put a lot of thought and a lot of time into how you're going to structure and who you're going to give rights to the system. But it hasn't been anything that's been presented to us.
So how do we take away an administrator's right to the system?
At any time, For example, if we go into the administration tab here, and the only person that's going to have access to that are your lead administrators, just people you give access to be able to even click on this. It's going to break down for you every administrator. So if we went in here and said, okay, let's review what Rick can do within the system. You click on Rick, it'll generate, as you can see, he's got access to a majority of the departments and triggering out alerts. You can say, wait a minute, I don't want Rick sending out any of these prepared alerts. They get rid of all those. This individual should not be working with the majority of these accounts. Maybe they have representation over a few cities. You just take away their rights. Update their profile. So you have the ability to give and take away any of those administrative rights that you've given them at any time.
Let's briefly discuss costs.
Cost is pretty straightforward. Cost is based off of your census population. So we have different price tiers throughout the country. You guys are just over 10,000, so I put you in our lowest price tier, which is 0 to 10,000 residents. This is an all-encompassing contract. You know, we're not going to charge you for additional trainings. They're unlimited. We're not going to charge you for NOAA. It's included. Picture video, mapping, any customizations to those registry pages, any imports, they're all included in an annual fee. Your text, email, paging, desktops, and social media are all unlimited mediums. Send 1 million a day if you want to. The only moving part in our contract is voice. It's the most expensive medium. It's how we, protect ourselves as a company. So we give you 25,000 voice calls to use throughout the year. Based off your demographics, our experience, that should be more than adequate. And the big thing is here, they are not increments or seconds. So if you go to 31 or 61 seconds, we do not double charge you. The annual fee for your county is $7.9 a year. It remains $7.9 whether you've got 5 agencies funding it or whether you've got 10, 15 agencies funding it, it remains the same. That's why we encourage these partnerships with other organizations and really start to push the money in one direction, streamline the communication. So your bottom line, you're looking at $7.9 a year for Mitchell County. What can I do to clarify the pricing?
We're actually a little over 10,000 population, so what would that be?
Well, I noticed that you just went over 10,000, so I just pushed you into the lower price tier. If you went up to 10 to 25,000 residents, you'd be looking at 10.4 a year, and we would give you 50,000 voice calls. But because you just reached that first one, we're going to let you at this price point. You'd be looking at $7.9 for your county.
And what is the multi-year discount?
Multi-year discount is when you do a paid-in-full contract. It's typically used more by counties that are funding the system with grant dollars. If you do a 3 or 4 year paid-in-full contract, it's 10% off the top. So if you did a 3-year paid-in-full, it'd be 7.9 times 3, reduce the whole thing by 10%. And then we can structure your contract however you want. If you wanted to do like a 3-year contract to lock in your pricing, you just pay it annually, we can do it, or we can do an annual contract that renews, it's up to you.
Go ahead, Betty.
What's been your experience in partnering with other agencies in other counties and making a charge to them?
There again, we're very flexible on the contracts. If you look at a group like Johnson County, they came on board and originally were just going to implement at Johnson County. But then it turned into a regional situation where we've got Johnson, Lynn, Cedar, and Iowa as a region. And all we do there is take the collective. So we would take the census pop of all 4 counties, put them together, and that would be, depending on what price tier they fall in, that would be their annual fee. So that's really where you get your discounted savings, is by doing partnerships with other organizations. So for example, if you had maybe you had a county that was looking to buy the system that had 80,000 people in it. They got a neighboring county that only has 10,000 people in it. Instead of them both purchasing a system, we would bundle them together. You'd be looking at their pricing based off of a 90,000 population instead of two separate systems.
Well, I guess the example I was thinking of was looking at schools being a separate entity, the hospital being another entity, the county being another one, and perhaps the city's another,
Oh, you're talking about internal
Yeah,
funding?
internal.
Within a county, it's really up to you. We can bill your entity separately, or you guys can handle that internally. It's up to you. I usually just see it based off the percentage of the population. So for example, if Mitchell County had 3 cities that were going to participate, I would look at their population and base their cost off a percentage of the total. And then we could bill you separate, or we could just bill the county and you guys can handle it internally. That's really up to you guys.
Well, school system, use that for an example.
With the school system,
Yeah,
a lot of times I encourage our counties to work with their schools regardless. I mean, if a county can fund it on their own and the schools are saying we just have no money to put towards it, I still tell them to partner up with the schools because they have such a good wealth of data. A lot of times the schools are already going to have something in place. Usually I would tell my counties, go talk to your school districts, and if they're currently paying $5,000 a year for a system, cut it in half, get $2,500 out of them and throw them under your account. It's not going to affect that 7.9 price point at all. So it really just depends on how many you've got and what they're currently paying.
We have a big agenda. Do we have any other really questions right now? I think we can discuss
You
this
know,
further.
it depends on how creative you
Discuss
guys
this
want to
further,
get. I've had other
next
counties,
week.
like Stark County here in Ohio, they're a very large county. The county said, listen, we're going to purchase this system, and we're going to give it to all of our entities, schools, hospitals, cities, whoever wants it, for the first year. We're funding it, we're paying for it. First year, it's on us. The second year, if you want to continue to utilize the system, I see it one of two ways. Either they give you a fee based off of their employment base. So let's say you've got a department that has up to 25 employees, it's an annual fee of $500. If you've got 25 to 50 employees, it's $1,000 a year. And just structure it as such. And we can always write up those agreements for you guys to use internally. We've done it many times. We've also seen it where the county says, listen, we're going to fund it. Any of our sub-administrators, any cities, any other organizations that want to use it, they get the unlimited mediums, the text, the email, the paging, the social media. But we're going to keep those voice calls for the county. So there's a million different ways to structure it.
Okay.
Typically, after you guys start these conversations, we typically will get a meeting put together and start to figure out how you want to lay it out there to the county.
And I think that's kind of where we're at now. I don't want to cut you off, I don't want to be rude with our agenda this morning. There's a long list, so I think you've really done a great job giving us an overview this morning. And our board will discuss it, and then we'll probably be back in touch at some point. And
Fair enough to me. I appreciate the opportunity to talk to you guys.
okay.
I will send everything over. Sheriff, I know I've got your email address, so can I facilitate that through you?
That'd be fine.
If you guys have any questions after you guys discuss it, or if you want to get another meeting set up for those that maybe couldn't attend, just shoot me an email or give me a call and let me know what the time and date.
Okay, we'll certainly do that. Thank you.
All right, thanks everybody. Have a good day.
You too.
Thanks.
Bye.
I had one request for closing a road to run a manure pipe across, and I said no. He did offer up, Wayne wanted to dig across the road and place a pipe. which I thought I'd bring up to you guys. I think you guys have been on board with that in the past. We'll take care of the critical details of how you want to place it, kind of parallel to our policy that we haven't put in place yet, but what we've read about as far as burying a conduit under the road. It's their responsibility. That being said, we're still progressing. I think the pipe project north of Statesville will be done today, hopefully, and then we'll go on to the next one over there by the dams, and we're still working on designing the whole structure there, so, otherwise we're just getting ready for winter.
Our site in St. Ansgar, are we gonna have to haul some fill in there? And
We'll have the stuff from the other site. It's a
I
matter
mean,
of,
it would really be kinda nice
I
to
know
let
it-
it settle this winter.
I'd be thinking about that, and I just trying to think, we couldn't get a contractor to do our bridge work, we can't get it ourselves. I mean, we're gonna be struggling, but it's something I wanted to look into, so. We'll see where we're at. We should have started a while ago, but with everything being so busy, we just didn't get a chance to get over there to pad it out, but.
How much stuff do we have to move?
We agreed upon verbally to take the pile that was there
Okay.
on the old site and then take the existing pad there down to the current rock level. That's kind of what we agreed on, so I didn't measure in cubic yard volumes, but I think with what's there, I had it figured out once what we were gonna move it for what we needed, and I think we had enough material between the two sites to work with, so. Yeah, that's on the big list of things to get going again, is that building project, so. Other than that, that's brief as I can make it, if you guys want.
Discuss the menu.
Oh, yeah, the amending of I have to amend my construction program in order to get the ER projects into the system. The ER projects are the ones that are funded by federal highway, and so I just need to amend my construction program through an agreement between you guys, or just to verbally agree to it. One of them is the Turtle Creek project, the bridge approaches and the guardrail. The total project estimate was $95,000. 76,000 will be federal aid, and then the 19,000 will be ours. That's an 80-20 split. And then the other one is the patching of the approaches north of Meyer. That's an $8,700 job, $6,960 federal aid, and $1,740 local. I think those are the only ones that I need to put into my construction program. The FEMA stuff I think we'll put down as maintenance, but these are kind of bigger projects and when they're federal aid, they gotta go through the whole system, so.
Do we have a motion to that effect?
So move.
Second.
Is that motion?
Motion to approve.
Allow the amending.
Allow the mending of the construction program.
And then,
That's exactly what I heard.
Okay.
just as a heads up,
Further discussion? Volkmander,
Aye.
Wallace,
Aye.
Walk, motion carried.
and then just as a heads up, I'll need a budget amendment here whenever we do the first one, because we've spent the money to pay for the FEMA projects and everything else. It's gonna be a substantial amendment, but I know that our carryover was good, so we'll have the money. It won't affect taxpayers or anything else for this in the secondary road fund, so whenever we're ready to do that.
Possibly look in December. But
Okay, that'll be good.
as long as you're not going over your bottom.
I'm not going over my bottom line, but it's more of a satisfy the state budget than it is the county budget, because they've got their categories and they're 10%, so.
How much snow are we supposed to get Thursday?
I don't know, they were talking a couple inches possible, so I don't know if that's gonna be. We've got a lot of trucks to check over yet, so,
We got a question behind you.
Just a simple question. The letter I had gotten from the Iowa Army Corps had
Yep.
said that would be between November and December, you would start work.
that
The way
was
I understood.
anticipated.
Anticipated, so now we're not gonna wait till maybe spring?
That was the anticipated thing to start the process. That doesn't mean you have to do it, they just wanted a timeline, because when
Yeah.
they give you that timeline, they give you, okay, now they start their permit period from that anticipated time, so. I'm still wanting to get something done, it's just taking a little bit
Yeah,
longer
as
to
far
get
as us getting
surveyed.
access,
Yep,
that was
yep, yep.
That's still our biggest
Right.
thing right there,
Yep.
but
So that timeline is just anticipated, it doesn't mean that it's set in stone, but
if you
we're
guys
trying
could
to.
work as fast as the guys that fix the road, That would be
If we had the
super.
equipment.
They had that done within a half a day.
Yeah.
So, yeah, that's what I need to know. so.
Okay.
Tony Collins from McIntyre should be contacting you about the right trail again.
Yeah, he was talking about the material, but
I'm gonna go have my coffee.
I have concerns about putting a trail back along the road.
Where, how close to the road are they?
They wanna go right off the edge,
On the forest slope?
right off the shoulder.
Is there a back slope to it?
Well, it's through town, so there's not a whole lot of ditch there, but I asked them why they couldn't put it more toward the sidewalk,
Right.
because that's right of way through there, but he said the property owners didn't want it. But I think it's a lot safer going there than right off the edge of the road, and, there's gonna be a lot of, I don't know that their estimate is gonna be accurate.
Well, they were discussing at the council meeting about like mailboxes are gonna have to be moved if they put it there, and there's a lot of variables they really haven't thought about.
ADA panels at every intersection.
And fiber optics, they're not, where
They're-
that went through at. and-
There's a lot to think about. I don't know where their estimate came from and who they're gonna have do the engineering on it. That's gonna cost money.
I think they just said, oh, their city cleared into lots of numbers.
I know, and that's a good way to start, but I don't think that they can, their timeline is a little bit ambitious to try to get it when they want it. And, they're gonna have to, being that close to the road is really, really tough. I know it's a 25-mile-an-hour speed limit, but there's a lot of work that goes into that too.
I see you got your sign, or you got your sign. Speed limit enforcement one, or is that
Oh,
the
the-
state's?
Oh,
By
the
staff?
electronic one,
That would be the states.
Okay.
but they're coming in slow.
Well, good. The whole
I
idea.
can't judge when I'm supposed to pull out now because they're going slower.
Yeah.
Well, is that officially then gonna be part of the trail, or is this just basically part of the city's trail?
Have they discussed at all using the city streets as their trail through town instead of running parallel with the road? I mean,
I don't
To
know,
me-
but they were talking about becoming a snowmobile-friendly community, and they get signs and stuff, and they go on Second Street for that.
the only thing I'm thinking is, I can't remember what their estimate was it $64,000 or something like that? I don't know why that sticks in my head, but, if they can get, there's enhancement dollars out there, and I know it's a process to get them. But if they could get enhancement dollars to improve some streets and call them bike trails, I mean, that could help them out too, and keep them off the main highway. But, it takes a lot of planning to get that through town too. And I like the ambition, and I'm not saying what they're asking for is completely wrong, but I think it takes a little bit more research into, to put it that close to the road. And I know the speed is 25 there, but you still have opposing bike traffic head-on with opposing vehicle traffic, no matter which side of the road you put it on. And if you split it, well, then you're looking at one lane crossing over and then crossing back over. So, I mean, it makes sense to keep the bike trail one standard width, but,
Well, the biggest problem is where it dumps out onto the Walnut.
right, yeah, there's a pretty
So
severe,
how far is it till you get back into the city? Well, it is probably the city, but
it's,
till you hit a side street or something.
yeah, what it was, I can't remember what the distance was. It was a couple blocks worth of length.
So that's basically what they're talking about, doing the trail along the Walnut Avenue, right?
That
And
stretch,
through town to Main
they were gonna
Oh, they
run it
went
all the
all
way
the way
to
to Main
Main
Street.
Street.
You couldn't jog over just the one block. and
Well, that's what I
still
was
hit the
trying
main
to,
street.
that's what I was wondering about, is why they couldn't jog over off the main drag and use,
Of course, it's their
That's what the
project.
snowmobiles do. They come in, they go a block over and come in Second. So,
There's just an awful lot of traffic on Walnut. I would want to move them.
when you go through town at 25 miles an hour, and then I try to imagine a bike coming at me, it's fairly slow, but that doesn't mean it's not any more safe just because you're going slower. I mean, it is, but.
well, he should be calling.
Well, and I talked to him earlier too, and he wanted to know about material, and I said, well, yeah, we've got a pile of material here in Osage, but that's gonna take a lot to truck. I said, does the quarry have strippings or anything like that that they could use?
And they haven't heard back from Lindsay. They
Okay.
contacted him, so.
see Kevin is here, it's,
Stan, I've got time, if you need to keep working through your agenda.
no, that's fine.
I'm fine.
No, we're moving you next.
Appreciate your consideration.
And you're welcome to hang around too if you want.
I'll just give you an update of what we have going on. This is kind of a quieter time of year for us. Things slow down in November and December. But we obviously wrapped up all our construction there that we were doing, and we're quite excited about that. It's been very good for our citizens in the community to have those services available. We really, right now, we're in the midst of the negotiations with our PPM union. They represent everyone but the registered nurses, and our hope is to come to some agreement with them on some different benefits than we have now for our staff, because we've had 4 people turn down positions that we need because of the cost of the benefits, and so we're working through that, but I think that will be a challenge for us. So that's what we're working on now. Working with Mike Scarrow, I'm sure you guys know Mike. He's a good friend of all of ours, I'm sure. Anyway, we'll just leave it at that. And I guess the main reason I'm here today is to just talk about how we might partner in physician recruitment. When I was with you a few months ago, we talked about difficulty in recruiting physicians. And obviously, the whole transition into the exchanges and the Affordable Care Act is not going well, so it's really putting a lot of uncertainty and worry into probably the people of the nation, and also those of us who are in healthcare and don't understand exactly how it's going to play out. So, interestingly, in Iowa, when they passed the healthcare reform and implemented Medicaid expansion, that will add about 140,000 people to the Medicaid roll. And there's some speculation where those folks will come from. Ideally, they're the folks who aren't insured, and that will move them to the insured, so we'll get better reimbursement. But I think a lot of folks that are already insured fall onto those roles by virtue of some of the milking of the system. I hate to say that. So we'll see some of our reimbursement decrease, actually, because we're taking people who are fully insured and then moving on to a Medicaid product. So we'll be interested to see how that plays out. But here in the county, we have currently 3 physicians, and we've bolstered our services by adding Colleen Burns, who is a nurse practitioner, and we're certainly glad to have her. And then Holly Voigt, who came to us from Olmsted Medical Center up in Rochester. But we need physicians because we always have to have either backup physician coverage or primary physician coverage for the ER. And then there's certain things people want to see the physicians for. And to maintain a lifestyle, we need at least 1 more physician, if not 2. Also keep in mind Dr. Ross, again, is just a few years from retirement. He'd like to sort of step back and slow down. So I know that in my involvement since I moved to Iowa at Mercy, that we had a once-a-month meeting talking about physician recruitment, and Osage has been on that agenda every month. But I think we've only had 3 or 4 physicians come in and interview in the last 3 years that I recall. So we've really struggled to even get folks in. So there's some data out now that shows with the implementation of the Accountable Care Act and what number of physicians we're going to need to meet the requirements of folks' health plan, so to speak. There's going to be a shortage of 47,000 physicians over the next several years. And then if you couple that with the fact that most of these good people go to school for 8 years and then are in residency or fellowship 3 to 7 years, they're really trying to survive, and most of them come out with $300,000 or more in student debt. So really our challenge now is to reach out and get 2 primary care physicians at a time when there's going to be excess demand and not enough folks. And so we have to differentiate ourselves when people, first of all, to get them to come and visit, and second of all, when they're in visiting, we obviously have to sell the county to them. So we've enlisted some help from a recruitment agency, and they came in and visited us, and I drove them around the county and showed them what we have in terms of the CRC, in terms of the businesses. I took this person to St. Andrew and showed them the Main Street, showed them the main street in Osage, how the buildings are all full, that we can support the community, there's a lot of community pride in the communities. Obviously took them to the CRC, talked to them about the schools, proximity to other large cities, so if it's someone that's of a different ethnic background, there's access to communities and stores that they can get their goods and services at to help them. So I don't think that we have a hard sell, it's just getting people to come. But for the most part, when people can choose between a larger city where there's more culture and shopping and other things versus a smaller place like ours, a smaller community like ours, they tend to opt for the bigger cities. So we have to do something to entice them. So one of the things that really is important these days, excuse me for rambling, I'm just trying to paint the picture of where we're at, I don't intend to ramble. But really, the thing that we can do to differentiate ourselves is helps lift some of that burden financially that those students or doctors face. I have a friend who just moved to Mason City. They went to school, they were in a private practice themselves, and they relocated to Mason City because someone reached out to them and offered them a position with significant student loan repayments. So they actually uprooted their family where they were at, all around their family because of that specifically. So it's huge consideration now. So if you figure $300,000, if you bought a house and paid it over 30 years, that's $1,600 a month just for student debt, the majority of which is interest. If you try and pay it back over 10 years, it's $3,100 a month. And so this is a heavy financial burden on them. And to me, one of the reasons we need these folks is to provide a better quality of life for our providers. But if we don't replace them as they start to phase out, also we'll be able to sustain the hospital and the clinics, and in turn, really to bring companies like Balance and others that are looking at coming into the community, you have to have a strong medical center that we can meet all those needs. And so there's a lot of reasons for this, but so we are willing to make the commitment to them in terms of a competitive salary. We've partnered with Mercy, and they have a very competitive benefit structure. The real challenge for us is how do we come up with funds to help augment our student debt? So that I was hoping that we could have some discussion today about how we can partner to do that. Typically, in the market now, you're seeing $25,000 to $35,000 a year in student loan repayment given to those folks to help them. And a lot of places are committing that if they'll come and stay, they'll commit that much to them every year until their student loans are gone if they stay in the community. And there is a commitment for receiving those funds for every year of money we give that person. They're obligated to stay in the community, or they have to repay too. So so I just wanted to come and see if we could partner on that and see what your thoughts were on that.
Could I make a statement as a member of the Board of Trustees, Mr. Chairman?
Go ahead.
Well, I know that Kevin brought this up at the last meeting, and Mark Waytek was there, and I must add that Mark Waytek is very much wanting to cut back, and he is 62. Dr. Ross said he was 58, but he is willing to cut back if we can get another physician, but he will. But, one of the things that Kevin brought up too was that so many people are coming out of medical school now don't want to work weekends, they don't want to take call, and that's gotten to be a problem. So that means that we have to have physicians that we're paying extra, residency and so on, we're paying apart from the salaries of our regular doctors. So it's, and it's part of economic development, I think,
Yeah.
I know, we've discussed this before, we actually, a few years ago, we thought about sending somebody to medical school as long as they came back here to practice medicine.
Yeah, there's a person that works for us as a CNA right now. She was just accepted to medical school, and I brought her down and said, I'll give you a stipend every year for the next 7 years if you'll sign a contract to come back to Mitchell County when you're done with medical school. And this person's response was, I intend to come back here if I can, but I'm single, I don't know where family might take me.
Just doesn't give you all my pants.
Yeah. We're willing to do what we need to do.
Kevin, aren't there a couple people right now that are in medical school that have kind of indicated they might, their, you know, the families here?
And most of those that we reached out to really like to stay in bigger cities when they're done. So we're even having challenges with the people from the communities necessarily. And I speak in general terms, so please take that for what it's worth. I don't want anybody to go find the parents of someone and say, why doesn't your kid want to come back?
I know Mercy has residencies. Do they come over to like our areas to get an exposure to know what they would be getting into, to understand
They
that?
used to come over and help cover the ER on the weekends. That was before the 80-hour-a-week rule was put into place. And so the difficulty we face with them now is that by the time they put in their time every day doing their rotations, they're pretty close to their hours, and those moonlighting hours count against them. So to come over and cover the ER for 60 hours on a weekend on top of their work,
You can't add it in.
it's difficult.
I know my daughter's
And-
going to radiology school, and they go all over it,
Mhm.
and it exposes, and a lot of them go, oh, I like that hospital.
And we would like to do that. Keep in mind, our doctors are seeing 30 to 40 patients a day. And if you add those students on top of that, that extends their day by 2 to 3 hours. So just to meet the demands of patient demand, it's hard for them to take on those residents and do that. And we would love to do that, but it really slows us down. But if that was what we needed, we would do that. We're not opposed to that. We're really, I'm trying to meet those residents and work with them. The reason Mercy has that residency is to get those folks out of the network. But a lot of those folks actually come in with an obligation somewhere else to go back already. And so we're working, I think we're having discussions as the CEOs of the hospitals and with them to try and make that more favorable for us so that people don't come to North Iowa and then go to Illinois or Nebraska or Kansas or whatever. So, anyway.
I understand fully, the economic impact of having a good medical facility for the whole county or not. So, that's not the, but I guess it always kind of bothers me when, this is more rumor than whatever, but I think this year, isn't your tax asking $600 and some thousand, if I'm not mistaken, property tax asking?
Yeah.
When I first started on the board, it was 400,000. And yet again, I keep on hearing Floyd County, that's a county hospital, and they have no tax askings.
Yeah.
And,
Well,
we
could, and Stan,
that's where I would like to be able to, somewhere along the line, come up with a little understanding of why this is happening here, and is it possibly,
that's a great question, Stan. So keep in mind that even with what's gone on in the country the last few years from an economic standpoint, providers of supplies and providers of equipment have not dropped their prices. They've continued to raise them. Luckily, we're part of the Mercy's purchasing group, and we get significant discounts that we wouldn't get if we weren't associated with Mercy, so there's a significant benefit to being involved with them. When we redid our emergency room and ORs, Stan, we paid for that with cash reserves that we had built through operations and other things. If we don't do that, if we don't have that tax base, we can't update our facilities, we can't buy the equipment we need, and ultimately we become
I
outdated.
understand that, but I
So,
think still, Floyd County has to be updating their stuff in that too, I would assume.
yes,
And-
they see quite a few more patients than we do, Stan. Their services they offer, my understanding is they offer more services and their patients stay in the county more, and so they have a larger profit margin, is my understanding. So.
Well, then if that is the case, how can we?
I absolutely agree with you, Stan.
These are things that, because we take a look at the whole county budget, and, there's various departments within our county budget. We keep on hollering, well, can we maybe save $200,000-300,000 here? Can we save, and everybody is reluctant to give up their territory, and yet again, the overall needs, we've got to put our money where it's gonna do the best good.
Right.
And yet again, I wanna make sure that we're, you know, I have no problem trying to help on recruiting a doctor or two. That's not the issue. The issue is really, in your case, is there more efficiencies that could be coming at the hospital that also would help? And when I keep on seeing the 600 and some thousand on my taxes, and Floyd County has none, I mean, I keep on, you know, that's a concern of mine.
Yep. And we're always trying to grow the hospital, and I hope, Stan, that you have seen since I've been in the community, that things have improved in terms of our patients, our customer service. Our EMS service was recognized by the state as a career service for 2013 because of the changes we've been able to implement. Really, our challenge, Stan, is we are in the network, one of the hospitals that is focused most on lean. We are doing everything we can to make improvements in our efficiencies and costs. The problem is just to maintain, our costs are fixed for the most part, to maintain our programs. We're always looking for ways to save money, Stan, I want you to know that.
But, well, like, here's a suggestion. Friday nights, I'll once in a while have the radio on and it's Osage football. Not that I'm a big fan of Osage football, don't get me wrong, but you're one of the advertisers.
He said
it. And yet again, maybe instead of just doing a generic ad on so many of these things, maybe you should be, like you said, trying to get services. Let's go back to the colonoscopy possibly. Okay, are you folks 50 or over? Maybe it's time to have, you know, actually start to specify, here's a service we can provide here, and here's a service that you ought to be taking here. And, you know, what I'm trying to say, instead of having those generic ads.
So Stan, keep in mind the cost of that ad is very little.
I understand,
to be a
but
sponsor.
still.
And keep in mind also that we get a significant portion of business. We have, I don't know if you know or not, but we have one of our physical therapists at the game. And by having that sponsorship and providing physical
No, but what I'm
therapists-
saying is it could specify a service as opposed to.
Stan's trying to grow more business for you.
I appreciate that. I understand. And so we're always looking, Stan. I want you to know that, right? And to be honest with you, Greg, what was it, a year ago I came to you and said, we need to improve the service of the EMS, and technically we could ask for more tax base than we are. And we added a third paramedic here and there to make sure that we always have paramedic coverage on call. And we could have, by statute, asked for more money. We could ask for quite a lot more than we are. But we said, we have an obligation to the county to be good stewards of the resources we've been granted. Let's make sure we're doing all we can and using them wisely before we ask for more. And to add another paramedic, we haven't been able to, I want to make sure that I'm not speaking out of turn, but to do what we needed to do was going to cost about $70,000 to $80,000. We haven't added out all those costs, but we have made some changes that have helped us to have paramedic coverage. 2 paramedics during the day, all week, and then 1 at night. That has been a significant cost out for us. But you'll see also that our response times, Greg, have gone from over 10 minutes to less than 2 on the initial response. And our EMS service is much better meeting the needs of the community. We didn't ask for any more money to do that. We just took the hit, okay? So I have a business background. I'm trained in business, and I want to know where every dollar's going, okay? And so I absolutely understand the tax base issue, and we are grateful for what we get. And without it, we would not be able to improve. We would not have enough cash flow on a year-to-year basis to keep our facilities current and up to date so that we could keep folks here in town. Okay? So,
Mr. McCarthy would like to speak.
What was that, Joe?
Said that he'd like to speak.
Well, I'd just like to add that, number one, the ambulance levy is set at 27 cents per thousand, so we can't add any more than that, and that's all we're levying. Our levy has stayed the same for, I believe it's, for how many years? I gave that levy to the board, and the only reason that it went up to 635,000 this year was the fact that your valuation went up in the county and therefore it enabled us. Now, we are only levying so much for general, and I think that was 100 and some thousand. The other item is either, is it IPERS or FICA we levy for? We don't levy for the other, and if you look at the hospital budget that goes in the paper, the printed, and the one we don't levy anything for, and the other we levy for. And we're allowed to levy for any insurance, the code says, but we're only levying that portion. We aren't levying for all of the IPERS that we could. And so, you know, that's the only thing we're levying for. I know that if we...
Betty, nobody's arguing about what you're levying it for and how you're using it. I mean, the question today really is trying to come up with more money to get a couple more doctors, and we would be remiss if we don't ask some of the questions of, I mean, anytime anybody comes here to the board, and when you were on the board, you're also going to ask, are you doing everything possible? And we want to, it's not trying to be downgrading of any
I thought
any
maybe,
type. No, I
I
mean,
thought maybe
it's.
you were thinking we're spending your money for construction, and we aren't.
No,
We're spending
no,
it.
but we also, I mean, you know, we just don't hand out a blank check every time somebody comes in and they just ask, well, we'd like to do this, yeah, here's a check and away you go. I mean, we're trying.
But also, it is mandated by the code that we're allowed to do that, so.
Right, I mean,
We're trying to, and Dan, just know that I am very conscientious of how our dollars are spent.
Yeah.
I am very conscientious of that.
Okay,
So, let's talk about how we can partner on the.
there you go, that's what I wanted to get to.
Okay.
How do we get to where we need to go?
And if it's, you know, I really think that we need to be in the $30,000 to $35,000 range, okay? And I'm not here asking you for all of those dollars, okay? I'm just asking, how can you help us, whether we partner and we do some fundraising, we can always take it out of our operating budget, but that means if we take it from one side, from one place, it doesn't go to another place, right? Hopefully by having that position, we'll have more access, be able to offer more services and keep more people in the county. So there could be exponential growth because of that, so.
Isn't there two different foundations? I realize that they're not, you know, directly hospital, what are the two that?
There's the auxiliary board and then there's our actual foundation. And the foundation is meeting in the morning and I'm gonna go to them and talk to them about how they might help us, so.
Because again, I don't have a problem necessarily helping out here, but I mean, they also, my understanding is they have a large sum of monies, both of them.
Yep. And I actually hit up the I shouldn't say I met with the auxiliary board last week and mentioned our need and asked them to make a commitment of some sort. And you know, that was, they weren't in an official meeting of the board, they were in an annual, a different kind of meeting, but I did ask them to see what kind of commitment they would be willing to make if they could. And I'll meet with the board in the morning at the board of the foundation and ask them. So I think if we all partnered together and worked together, I think we could do that.
Well, it's definitely a need. I mean, I don't know how, when I was young in the county, there was a lot of docs.
10 doctors.
Yeah, right. I mean, and then we only had, what, 2,000 more population? Or we at
And
around
they all
12,000?
operated out of their own offices.
I know.
Yeah, they're just the change in the payment structure from Medicare and payers has really driven that. You know, you used to get whatever you charged, they would pay you, and now Medicare's put payment methodologies in place that regardless of what you charge, you only get a fixed amount, and so.
But anyway, getting back to the recruiting, the 25 to 30 is for each
One.
one per year. And that would be a per year we're looking at.
Yeah.
And then they're
And what would you
coming
be, would you be asking any of these docs for them themselves to also be paying in part of their student loan, or would it be just a matter of we pay it all and they have no skin in the game?
You know, Stan, that's really their choice. I mean, it's just,
No, but I mean, you're gonna have to make a presentation to these people. I mean,
if they're going, what they need to understand is that we're only gonna give them so much, right? And if they don't wanna pay that additional interest, they need to be working on getting it paid down.
When you
For
and I
every year
talk,
we pay, they are committed
Right.
2 to 1 or whatever.
Right, so some places, like I said, have taken the approach, as long as you stay here, we'll pay, $25,000 or $30,000 a year, right? So, so you can look at that two ways. Somebody can say, all right, I'm set for the next 12 years or 15 years while someone pays my student loans off. Or, okay, I'll come here for 5 years and take that, and then whatever's left, I'm still on the hook for when I go. It depends what approach they're gonna take and what their motivations are.
It's their choice to be a doctor in the first place.
but if they do take that and are here for 12 years, well, now they got some skin in the game because they've lived in this community for 12
Yeah.
years. Their kids are
By
probably
then-
growing up here and going to the school, so you kind of,
And I think
Capture
if
them
you
that
get the multiplier, like the 1.5 to 2 years for each year payment.
But the other side of the coin is if you're tying it up for 12 years, you're not also able to do a second or a third. I mean, unless we have another source of income, like from the county, that we could, so, I mean, we're also limiting our, because again, if Dr. Ross is gonna be retiring in a few years and you have the other, I mean, you got a need again already for,
Yeah. My proposal wouldn't be that we'll pay you every year you stay here. I mean, it would be like $30,000 a year up to $150,000, so that they still have some skin in the game, Stan.
That's what,
Yeah.
yeah, just so we have an idea of what we're.
but this
what we're
idea
gonna
is not
discuss.
new, correct?
No,
No.
I mean, this is being played out across.
everywhere.
Standard.
In fact, there's actually places now who are going out and getting residents in their first or second year and giving them a stipend and tying them to them so that when they get out, they come and then they provide student loan repayment after. So, and we do, for the way it works, you have to pay attention to what's going on in the market. So how it works is, what we would do is make a payment for them every 6 months. And then they would be obligated for that 6 months, and if they left, they would have to repay automatically whatever hadn't been forgiven from the time that, from that day till the end of the 6-month period.
Maybe you're familiar, I know that Economic Development, Brenda presented that there's a way that people can donate to a fund and then make the payments be for a certain thing. Maybe you should talk to Brenda about that. She was talking about like the Stacyville Park Fund. If they would have done their first year donations of $72,000 into this, and then the payback would pay towards the expenses of the park or whatever, that it's a new funding stream that's tax deductible.
There's a tax credit.
It's a tax credit, but then it's just to you. You might want to talk to her about that, if you could do maybe something like that.
I think you get extra tax credits for that if you go into a foundation somehow.
Yeah.
I mean, that,
Yeah.
it isn't just a normal,
No, it's a special thing, but it was very interesting that you could get people to donate towards that, and then,
Well, and maybe we could have them donate to that, and that would go through the foundation, and, I mean, that's the purpose of it.
and have it as
Yeah.
restricted donation, that they would only donate to that. Maybe we could get more funders.
Yeah, I mean, and I'm willing to go out and do community fundraising too. I think there's plenty of people.
Well, I think it's something we all want to see in this community. I mean, I'm willing to work, myself, I can't speak for you two, but I'm willing to do whatever we need to do. I mean, it's coming at us sooner rather than later.
well, you gotta be bringing the annual report here, this is November, and why don't you meet with both of the hospital foundations, find out what they wanna do, and come back to us, and like I say, you gotta bring the annual report anyway. In the meantime, we'll talk to Barb and see where we're at. We got a lot of irons in the fire.
Okay.
One more isn't gonna matter.
I'm sorry, okay.
It's easy to say,
It,
easy to say.
we,
All right, well,
That's enough.
just so you're aware, I've gotta move forward and make commitments.
Sure.
So I'm gonna just go ahead and make the commitment, and obviously if we have candidates come in, because I'm working hard to get that, we really need that right now. So if I have to make the commitment, I'm gonna do it, and we'll
Was
get
there a
back together.
consensus that we'll participate?
yeah, I
I
mean,
mean, I think we find it one way or the other, won't we?
Well, of course, like you say, we're gonna have to know the dollar amount that you're gonna be asking, but yeah, no, we'll be willing to try to step up to the plate. It's a matter of, I mean, again, I'm not willing to just sit here and say, yeah, we'll get 30 or 35,000. I mean,
I don't think that
without
was
these
the
others.
expectation. You know, I was hoping if you would, you know, be in the 7,500 to 15,000 range, something, I think we can work to come up through operations. What, pardon?
Let's get to it.
I mean, you know, then we can work to do fundraising and do our other things, but if we could have that sort of as a foundation of our
Let's say the
commitment.
hospital, the foundation, the auxiliary, and the county would split the 30,000, about 7,500 each.
Or if you would commit a certain amount, we would commit to raise the rest of the funds somehow to do that, either through operations or the foundation. So,
Well, why don't you give us a week to think about it?
Okay.
And, like I say, we wanna get back to Barb and see exactly where we're at, and, like I say, we've made some other commitments for some other projects, and we're all over the place. I mean, with this flood thing, like,
Yep.
you might have heard Richie say that, you know, we're having to right now pay that out, and we don't get paid until later, and
yeah.
and so we tie a bunch of our money up, you know, sometimes, but we just have to find out where we're at.
And essentially on something like this, keep in mind, in terms of the timing of this, it's gonna take 30 to 60 days to get the people in here, negotiate, get them signed, and then you got 90 to 120 days by the time they can give notice and their other practice get relocated. So we, you know, realistically, at this point, we're into probably April or May before we see something, unless we find someone that can come just like that. So it's not something that we need immediately, it's just more of the commitment to do so. So I appreciate your time.
Okay, thank you.
Thanks.
Well, let's see. Sheriff Beaver, do you wanna go next?
Sure. October fees for you.
October fees. Hey, that's a nice one.
At least today you ain't got far to go.
Neither do you, Randy. Not funny, huh?
I know.
I looked over everything, I'd make a motion to accept the sheriff's report for October.
I'll second it.
Where are we at here?
5.
Aye.
5 here, okay. Been moved and second that we accept the sheriff's report, further discussion. How many in the Crowbar Hotel this morning?
I'm sitting on 2 this morning. I talked to,
Locals or?
yeah. I talked to Sheriff Lynch last week about his situation down there. We agreed we'd talk again and that he would bring it to his board at budget time, which they start early December, you know.
More like January, but maybe they do it in December too.
Yeah, he mentioned even a November worksheet that they get, so we'll see what kind of reaction they get out of them and what we can't put together. We're kind of both open to working that out, so we'll see what they say.
What actually is his situation?
I have to read the jail inspector's report. Rick told me it's essentially the same thing that he's been writing for several years. He just continues to write it, that it needs to be taken care of, so I don't know specifically. I know there's some structural issues with the roof when it rains, and other than that, I don't know, Stan.
Supervisor Sugarcraft just said it was kind of a to-do list type thing that they've been dealing with, and it didn't say there's no deadline, and that they're gonna have to not take prisoners or anything, it's just that at some point you're gonna have to do some updating. He said it could be 20 years.
So, anyway, I had a conversation with him about that, and we'll see where it goes from here. And then lastly, you know, Shannon, you brought me a traffic issue up in McIntyre last week. Some of it's been taken care of by the paperwork I've seen, but they'll continue to be up there, so.
I have 2 questions. Is a flashing red light a possibility there? Was one of the things at the council meeting that I attended was brought up. And then does the county have an ordinance? I know I have a dog at large ordinance, but do we have ordinances regarding noise ordinance for dogs?
Yes, county does.
Talk to you later then.
And as far as a flashing red light goes, that would be something the board would have to make a decision on.
That was just another concern.
We'll enforce it.
That's in the city, isn't it? Don't they have, or do we put flashing lights,
Well, that's our, I mean, we maintain that road,
Walnut?
you know, that,
Well, it seems that some of the roads in town here, we don't maintain when they hit the city limits. But we do help out. I
And
guess.
maybe it is city council, but somebody other than
But they
me.
have to agree, I'm not opposed
It's
to
not your
that,
fault,
Stan,
it's
I
theirs.
think
Well, no, we'll just do the enforcement on, I even thought stop
we do
sign.
the flashing red light, we.
I thought a stop sign to stop them totally
No, I
north and
mean-
south.
They talked
It
about
would
this.
help.
you know, you go to Charles City over the viaduct, I don't remember what road they really, you know, that first turnoff. And there's a flashing yellow there that's solar controlled, and I'm sure you know, those solars aren't exactly cheap, but you also could get a solar activated.
I know Greg's, or Rich said they put red flags on the speed limit signs.
Yeah.
But you've written some tickets.
Yes.
Good.
You may actually hear some complaints the other way now. But anyway, we're trying to get it taken care of.
Thank you.
Okay, let's see, did we vote on this?
No.
No. Further discussion? Hearing none, Voigtlander.
Aye.
Wallace.
Aye.
Okay, motion carried. Item 7, hazard mitigation plan update.
That's me, and you're Ray, correct?
Yeah.
Yep, I'm Matt O'Brien, the new point of contact with hazard mitigation at my office. I will do this briefly and try not to take up too much time, but I believe it was back in March, we had one of our planners had a brief meeting with the supervisors before Shannon was here, obviously. Then I met with Shannon a month or so ago. So basically just the thing that Mitchell County is different than like Worth County does. Previously, and I'll stand over here. Previously, Mitchell County did a hazard mitigation plan for unincorporated areas, which other counties had not done. Based on that, it's kind of an update, so FEMA requires different things, kind of, so. Basically, I'll just point this out. I could, basically, this is the list of the mitigation measures that were in, I think it was approved in 2010, the plan, and then, FEMA basically just wants a brief update, just brief narratives for each one, and basically just say if it's completed, canceled, or ongoing, so. To save time, I can just give this to Ray, and he can just take like 5 minutes, and when you have spare time, just go through that, so. Basically, it's just develop, publicize emergency management plan, to say if that's ongoing or not. And then continue national floodplain insurance compliance. And this is all for unincorporated areas, so it's kind of a little more straightforward than when you're looking at Osage or other places. So I can send that to you as an email, and then I'll give you my business card also.
How are you doing with the incorporated towns? You had a list that you needed.
Oh,
to
yes, well,
contact.
Wrightsville did finally, I know Wrightsville's had issues with council members, and January is one of them, they'll have the new ones in. And last time I was there, they didn't have a quorum, which I didn't need quorum, so it worked out, so.
And McIntyre's, no.
McIntyre's done, Carpenter's done, Osage is done, St. Ansgar, so it's just Mitchell and Orchard. So those towns, it's their decision if they want to participate or not, but if you guys have any connections with the council members or mayors, you can just let them know we're still waiting to hear from them, so. I left it, messages on answering machines and sent 2 letters, and just basically I need a notice to see if they want to participate or not, so. I know it's something you guys can't force them to do. So the other, this brief thing. And I'll just give a brief schedule. The plan will be prepared by January 27th, and I'll request that just come to the board meeting and give a brief review, and then I'll review it with other towns, and then that'll be during the time FEMA's reviewing the other home. So we're basically right now I'm ahead of schedule, so that's good. So
That's when?
it'll be sometime in February.
Okay.
So basically, at the previous meeting back in March, the planner, I think it was Laura Clement, came. She was just working off of the hazards that were identified in previously. But now Iowa Homeland Security and FEMA, they had a larger list of hazards. So basically, I just needed to rank them on probability. So animal, plant, crop disease. You guys think that's highly likely to occur on a countywide basis, so not just Florence. So I mean, usually put 1 and magnitude severity. If it does occur, it's usually it does pretty. It has a larger magnitude. But the warning time is pretty good in duration. It's usually longer. And then dam failure. You guys, do you think that's highly likely to occur?
Nope,
I don't know, we got a thing on here about dam repair.
Yeah.
we already repaired it.
Oh, okay.
Okay.
I think they did anyway.
Okay. So we could just put 1. I mean, likely won't cross out and put 1.
They
But
were working on this.
if the dams did fail, do you think it would be a large severity?
No, not for us, maybe for
Yeah.
Charles City, but
So I was talking to, I believe it was McIntyre, that said something about dam, or Stacyville, I believe. So if it does fail, it's not going to be a huge issue. The morning time usually just happens pretty quickly, though, if it does happen. Duration 1, 6. And then drought. They have major issues with drought. So is it yearly, or it's usually not yearly, maybe every other year. But the magnitude's
Too much
pretty.
rain on it.
Yeah, magnitude's pretty. I mean, pretty severe usually, based on the data I have. The warning time is pretty good warning time. Duration is usually a pretty long time. And then what Laurel Clement got from last time, you guys did want to add earthquake to the hazards. We can cross it off if you don't want it.
We're on earthquake, technically.
Yeah.
There's possibility.
Yeah. Some towns will cross it off, but according to like EMCs and FEMA, will be good just put it on there. So usually that'll just be 1. But if it does happen, it's usually not bad as 1. Warning time is usually. So. And I can just send a copy of what these numbers real quick to Ray and look over it. So another one of the weird things, towns usually cross it off because you can't really monitor expansive soils a bit. They do exist, but kind of one of those things you don't really can't tell how they're affected. You know? So we can cross that off. Expansive soils.
Well, does it go against us to leave it on?
Or I mean, just if you leave it on, it gives me more work to do.
If they address it, if you
Yeah.
Well, expansive soils, that comes up in years of when you have drought or excess rain.
Swelling, yeah.
Right, and that's, I just know in talking to other supervisors at different meetings, and this is maybe especially in southern Iowa, but this past year they had the drought, and now they've had quite a large number of foundations that failed because, you know, so I don't know whether to leave it on or to take it off.
I mean, it's always good.
I leave it on just for,
Yeah. So we say the probability is from a 1 to 4.
One.
1, okay.
I haven't heard anybody, you know, having a problem with that, but it's not to say it's gonna happen. If it gets dry.
And yeah, it's kind of the warning time. It's kind of one of the key things. The warning time for expansive soil. I don't know if you're really warned about it.
That's when your wall falls in.
And another thing, extreme heat, it's usually, there's a lot of definitions about extreme heat. And it's usually based on individuals' exposure to sunshine and sunlight. So the probability, you think you get extreme heat every year or every other year? The magnitude severity, usually jurisdictions don't want to get too high. The warning time is pretty good warning time, usually like 4 factors warning. And then duration, usually pretty quick here. And then flash flooding is one duration, which is, flash flooding usually occurs pretty fast. And then do you guys have any issues with grass or wildland fires? Was that?
Only in New Haven.
Oh, okay.
We have the slow detectors on fire.
But that is in unincorporated areas.
No, not this year.
Some years.
Yeah, we had a pretty good crop fire north of St. Esther 2 falls ago.
Well, they had a combine crop fire on 218.
Yeah.
It's usually towns, they say it's high probability, but then the fire departments are usually, they do a really good job.
Right, yes.
Get out quickly. So magnitude severity is usually not that. But then hailstorms are usually a quick duration. Some of these numbers I pulled out of the previous plans, such as quicker process. And then hazardous materials like ammonia and hydrogen. Because usually EMCs are more aware of the hazardous materials than other people.
Could be every day. And could happen in Mitchell County as well as Worth County, but I had 2 in Worth County in 1 week.
Okay, so highly likely. And then, so the magnitude severity is usually the,
It depends if the manure spill that they were speaking about earlier was near a pile inlet.
oh,
Yeah, that's
Okay.
considered a hazardous material and needs to be reported.
so no, they're not always reported.
That's right. And with that, DNRs,
So I have like a big long list for Mitchell County for several years, and you know, it's probably a lot more than, I usually put a statement that says they're not all reported, it's just based on best available data.
it's like a car accident, we never know when it's gonna happen.
Yeah, so warning time is, and duration is usually cleaned up real quickly once it is reported, for most, not all.
In the last 2 spills I've had in Worth County, DNR would not come out. They let me and the fire department go.
Okay. And then we get the human disease, which you just like. Usually, people want us to focus on pandemics that occur like once every 30 years. But then you get into the issue of STDs, seasonal flus, and just depends on what you want probably. So, one. So that goes with FEMA. So that's what FEMA expects. The magnitude severity is usually not that bad. It's usually pretty heavy system. The warning time, you usually know when disease from the seasons. And the durations are usually longer. Then we get into infrastructure failures, usually bridges breaking or structural fires, communication failure.
Well,
Been there.
there we are, communication failures.
Sometimes it happens more than others, so. So duration, usually it's fixed quickly, so I'll put a 1. Then we get the landslides, which you guys wanted to add. Towns, every single one of the towns crossed it off, then.
Landslide,
Landslide, yep.
we don't have anything.
So we cross that off. And then radiological. So it's based on high-level radiological waste, it's unlikely to occur, but then you think about hospitals have very low-level waste.
You're not talking about like radon in basements? That does happen here.
I mean, well, radon, then they want us to kind of separate individual issues and community issues. Because radon's usually more for just individuals, so. Usually jurisdictions will put 1. The magnitude severity is usually 1. Warning time usually does happen quickly, though, it does. And duration usually can be 4. Then we get into the duration for river flooding. So I just had,
It's up, it goes down, it's really
Yeah.
fast for duration. But there's a lot of leftovers,
yeah,
debris.
they used to have the ranking above that cascade, I can't remember what it used to be, the effects afterwards, but they don't have them anymore. So we get duration for a severe winter storm. So usually towns put forward the jurisdictions. So the last one that wanted, you guys did not have in the previous plan was sinkholes. Like Osage, they say that there's sinkholes, it's not issues, they're not really.
Yeah, marker
In the unincorporated area, do you guys have any issues with sinkholes?
Sinkholes, we do,
There used to be quite a few out in Southwest, I know, but I, don't know about all
These are good. I mean, based on my knowledge, they're highly likely to occur based on DNR, I would say, so. But what mainly I needed from you guys was just the severity and magnitude.
Warning.
The warning time before, and the duration. And then the other, just the terrorism is kind of the ones that, there's a lot of debate on that. Like it should be 4 1. Some counties will, on a countywide basis, will put 4, like down in Franklin County, and then Hancock County, I can't remember what Worth County did, but Hancock County put a 1. So, just with terrorism, you think of, they put underneath it agri-terrorism, drug manufacturing. So it's not just the large scale international threats.
It isn't if it's gonna happen in Mitchell County, it's when.
So you want me to leave out, in the narrative I read, do you want me to leave out agri-terrorism or the agro-vandalism?
I don't think so. I'm going to Minnesota in the first part of December for Minnesota, Iowa livestock transportation across borders, and I don't think you ought to leave that out.
Okay. And then magnitude severity, if it does happen, that you think would be for catastrophic.
If we had someone plant FMD in Mitchell County, it would shut the state down.
Okay. Yeah, we don't, usually towns look for jurisdictions for the warning time. If it does happen, it happens quickly. There's no warning time. And then duration just happens, and then you have side effects. And then thunderstorms and lightning for duration is quickly. Tornadoes quick. Transportation incidents are quick. Car collisions happen quickly. And then windstorms, usually put 2. So basically, that's all I need to do, and just show that I did not make up these numbers for you.
Okay, thank you, Taylor.
Thank you, Matt.
And I always have, briefly, we'll have everyone who had to listen to me have signed the sign-in sheet, and then we'll be on our way.
Everybody?
Oh, yeah, you just have that.
You want their position also, don't you?
Or yeah, you just put EMC.
Tom took off, but did he leave a project update, Joel?
Yeah, he said everything's progressing well, and the meetings, progress meetings are 9 and 10:30. I had 10, but I thought it was 10:30. 9 at Hinkle Trailer for waste pretreatment, and 10:30 out the city's wastewater.
Tomorrow.
Yeah.
Okay.
Yeah.
Item 8, conservation loan for Mitchell Mill Dam repair.
Evan was here, but
He left, he had a long time ago, appointments, so
Okay,
he left the promissory note there on that, and this is,
are we borrowing, are we lending the money to that company and then they're paying us back? Is
I
that
think
what-
that's the way it looked, this was
That's the way it
prepared by
looks.
Mark Long, so $10,000 to,
Our partners in the dam from California, we're basically paying for all the repairs and then they're gonna pay us back with the revenue from,
That's number 8 then.
yeah, 100% of the revenues earned by Mitchell County shall be applied to this note until paid in full no later than June 30th, 2015.
Okay.
Signed by the chairperson of the conservation, Emily Coons.
That was for $10,000.
Correct, yeah. Interest is 2.5%.
you make a motion.
Sure, go ahead.
I'll make a motion to approve the conservation loan in the amount of $10,000 for 2.5% for Mitchell Mill Dam repair.
And I'll second that.
been moved in second, further discussion. Do I need to send these to you or just maybe?
Well, she did. It doesn't say there you did.
Okay, I mean, the ones are asking us to,
Yeah, I wonder if it's signed.
Further discussion? Hearing none, Paulus.
Aye.
Wolflander.
Aye.
Watt, aye, motion carried. Item 9, approve the minutes.
Motion to approve the minutes,
I'll second it.
And that was the latest copy, right? Right. Okay. Moved in second, further discussion. Hearing none, vote please.
Aye.
All those.
Aye.
One, motion carried. Approve resolution 893-13, authorizing the use of a preliminary official statement, which is in your packet, I believe. That would be this one here. And this is for the Valid project, $6,500,000, backed by GO purpose bonds.
Sign it. Let us know you're here.
motion to approve the resolution 893-13, authorizing the use of preliminary official statement.
I'll second the motion.
Moved in second, further discussion. Hearing none, vote Lander.
Aye.
Hollis.
Aye.
Walk, aye, motion carried. And then we have bids for tree removal. Two of them now?
Yeah, two.
Okay. And Rock Creek Tree Service here. Tree removal to be done on courthouse grounds, 14 trees as per marked. Take down, clean, and haul away all wood and brush. Leave stumps at 3 foot. And this is Rock Creek Tree Service, $8,200. Give that a little more oomph.
Yeah.
And this is Sharper. For clean trees located around the courthouse, $8,400. So Rock Creek Tree Service has the low bid, $8,200. Do we have a motion to accept?
Make a motion to accept the bid of $8,200 for the 14 trees.
I'll second that motion.
Been moved in second, further discussion. Uh,
And but,
That didn't have
Mark
stump or any
Walk,
mention.
Mark Walk, private citizen, wants one of the trees if, and I should contact them to Rock Creek, because I wouldn't mind trying to get one of the hard maples to make a cutting board.
If anyone else is interested, they can contact the
it's a
board.
big cutting board.
Well, further discussion? Paulus.
Aye.
Bookland.
Aye.
Walk, aye, motion carried. Discuss selling county vehicles. We got what, just Ray's old truck?
Well, maybe we get rid of that Tahoe, and then Peggy has a little car, she still have
3 vehicles.
Conservation had one, but they've sold that.
They had
Oh, they
one
did.
for sale.
They got good money, I thought, out of it.
Should we take ours out there and sit on that side?
Most of the bids were like $400 or $500. One was for $1,000, and I think there's, that one sold for, was it 2,300, 2,400, something like that.
Wow. Did they have an
How
asking
many
price?
miles your truck
No.
go by?
Nope.
My truck, I believe it was 129, close to that.
What year is it? My car. 2005?
Consensus,
Yeah.
consensus of the board then to have the county auditor locate all the cars that, or vehicles that need to be and run an ad and
Like we've done in the past, sealed bids.
Sealed
Yep.
And have the right to reject and accept to reject any offer.
if we can get that in next week, we'll give them 2 weeks, or that would be long enough, wouldn't it?
Well, and, we can put all vehicles in one
Brandon's
spot.
name on it, so you can get signed.
Just come.
Out there, fly.
Yeah, let's do that.
Can you sign it, please? That you were here for the meeting?
Okay, consensus of the board on that one. Item 15, discuss revisiting October 29th minutes regarding Otrano Bridge donation.
I guess their office had a call last week regarding the minutes from October 29th. Put in there Mitchell County Historical Society, and it probably really should say Mitchell County Historical Preservation Society.
Yeah, I'd make a motion that we change the minutes to
Reflect
reflect the correct language.
Miss Mitchell County Historical Preservation Association.
There you go.
Association.
That's the official title I was given.
Okay. And I don't know what, Adam had something that day and I didn't have a copy of it, so.
That's what Kurt gave me a copy of. He said that's the
And that's
official
your
title.
second?
I will second that, but to do it again. for that. Sorry.
No problem. Been moved and second, further discussion. Volklander.
Aye.
Pollock.
Aye.
Walk, aye, motion carried. Approve placing $5,399.68 in the land acquisition and capital improvement fund.
I'll make a motion to approve 539968 to the land fund.
Let's second that motion.
Been moved and second, further discussion. Hearing none, Paulus.
Aye.
Volklander.
Aye.
Walk, aye, motion carried. Items to note, meetings attended.
Yeah, I went to the wellness committee meeting, and we discussed whether or not we want to continue with the wellness plan with Wellmark. And I did some follow-up discussion with the two ladies that are in charge of it, Wellmark and Isaac. And we can sign the contract, and, because we're discussing how to redesign it. We can sign a contract with $50 per participant, and it can be carried over until next year. So I had Lowell put down for next week for you to sign the contract for wellness for next year with Isaac. Isaac gave me lots of good information. I gave you guys a couple handouts I did have. I'll type up notes. A couple of the good things that they talked about was, they have an open records committee. There's a chapter 23 now, in addition to 21 and 22. They came and spoke with us. They're willing, for schools, cities, counties, if you have issues, they're more of a resource, technical assistant. They advise you to come to county first, but if you have questions, just generally, they can tell you the protocol, and it's not, they don't make rulings necessarily, they just give recommendations, not recommendations, but just ideas and things. DOT meeting about the fuel tax was very interesting. They discussed, like I said earlier, the dyed fuel, the estimate is really low from people because there's no information that the state has on that, so if they do that, it would be a lot more than what they project. The other thing, one thing they did talk about that the DOT is talking about changing is right now, the DOT gives overload permits in Iowa. Most states around us are $75 to $100, and it takes a couple days. Iowa is within 1 day, that's $10. So they have a lot of people that have overloaded loads going through the state of Iowa that could have gone through Minnesota or Missouri, but they come through Iowa because of the ease and the cheapness. So we're getting a lot more use on our roads of heavy loads because of that, so they're going to raise that probably, because they kind of want to make it, at least that we're competitive with other states, so that we don't have excess traffic coming through us. Because they said just the increase on road traffic is phenomenal. And ISAC will have more reports. I give you guys reports on the recommendations for the state. The American Affordable Care Act, we had a meeting on that, and I'll give you notes on that, because there's some details that might affect us as well. And I did, went to a veterans meeting, and I did, at the wellness training we discussed, we do now have a trainer in the county. Public Health has a Heart Saver CPR first aid trainer, so we no longer will have to purchase those services out of county. I know last planning session, Greg had paid $400 for CPR training, and county care as well, that's $400 to $500. The cost to us will be the $5 for the cards and the hourly wage for the home health staff. So that'll be a cost savings about $750, as well as I am trained as well. I did find out that we have an AED for the courthouse that they're storing at the county care facility, or at the home health. I brought it back to the courthouse offices and trained the janitor, Veterans Affairs, the recorders, and the auditor's office, and I will do the other two offices. We just have to have a place to put it in the hallway, but we do have an AED.
That's the defibrillator.
Defibrillator, totally automated. I can train either one of you. We've had it for 2 years. We put the battery in last week.
I remember there was some grant we got that.
It's an awesome system. I'm glad we haven't ever had any issues, because that's one of my things that I really want to make sure we have coverage for. The other thing, when I came back, I did meet with Veterans Affairs. There's certain reports that we can do to see where we rank among the state for veterans benefits. The average veteran should get $2,000 in benefits. So there's a report we can check on to see if we need to increase our availability to the public or do more outreach for that. He also did say on Friday he got some Korean War books that the Korean government made. They're available to veterans. First come, first serve. He only got 40, and we have a couple hundred veterans and or their families in Mitchell County. So Ray and I discussed, he is donating one to each local library, because about 20% of our veterans. Larry is Veterans
You
Affairs.
said Ray.
Oh, I'm sorry, Larry. We discussed it, he's donating to each library, so that when the veterans, because first come, first serve, we would get about 10 to 15%. Maybe 20 would get them, and then it would be too bad. So he's donating to each library, the 4 libraries in the county, so that they at least can have access to one. And for our land overlay for the rollback and the ag fund, there's an overlay that's about $30,000 per county. We had a meeting with Department of Revenue. She does have approximately $300,000 she can give out as grants. So I need to talk to Amy about that, because one of the criteria, she says, smaller offices, smaller counties, like 4 staff or less, and we probably fit that criteria, but they had just gotten the money the week before ISAC. So they hadn't got a lot of information out, so if we find out they're just doing the application process forms, what we can get in there is first come, first served money, so we might get some help in getting an overlay on that. And last night had an empowerment meeting. We do have Learning Connections at St. Ansgar Schools. It's a 0 to 5 for parents, education. The school supports it in their school system. And the director also has another program that FSC funds through Charles City. They just received a national accreditation that was a 4-year process for Learning Connections, so that was a big deal. We had a recognition, and the state person came and presented her with a plaque because it was a 4-year process to get it done. And now our area, most empowerment areas have 20% of their providers for 0 to 5 that get it. The Floyd Mitchell and Chickasaw has 100% of our providers have earned that accreditation, which is kind of a model for the state. So good meeting, and that was it.
The FMC landfill last Tuesday night. Just normal, approving the payments and stuff, but we did come up with well, we didn't come up with a problem arose with the farmland out there. Evidently, it seems that at some point in time, the grass waterways were dug up and planted, and we had a 5-inch rain, and we had quite a large amount of erosion. And I contacted the NRCS and they went out there and they said we're gonna need scrapers to kick the dirt and put it back where it belongs and rebuild the waterways. So we had a little bit of discussion on that, and the board is in favor of, doing whatever we need to do to protect that land out there. So then after that, the next day I had a Board of Health meeting, and there again, they run into the same problem as the hospital, is being able to recruit nurses and nurses' aides. And they have, I think they have one person that they said that they were looking at and might possibly being able to get another home health aide or nurse, excuse me. Other than that, set up meetings for, starting to work on the budget for the coming year and things like that. So that was my 2 meetings.
I had county conservation, again, that they got some good money out of that van. Not only did they want to do something on the dam, they have 3 pieces of property they're looking at, and I think they'll be trying to come to us again and trying to get our permission to borrow money, possibly to, they actually have a funding source with the piece of property that they purchased down here on the Floyd Mitchell line, where they have 80 acres or so in conservation reserve. So they're getting, they say they have a funding source that's actually helping on some of that. Last Thursday night I went along, actually watched the awards thing, because they could take 4 people. City of Mitchell got $10,000 for their park. I think this next time around, I figured out how to get them more money when they actually went and buy the playground equipment. The food was absolutely excellent, that's where I went. Tried to take some pictures. I gotta learn how to operate that camera in a little darker setting. My pictures didn't come out so well, but the other thing that is really starting to concern me more and more is apparently, according to the Census Bureau, the government, Treasury, and so on and so forth, 40% of the people here in the U.S. earn $20,000 or less annual income. And I realize some of these are retired people and so on and so forth, but really 40%, on a 40-hour work week, that's $9 and I think 67 cents an hour. And when you have this many people earning not even a livable wage, this is going to eventually cause problems for Greg. It's going to cause a lot of pressure on the food bank and so on and so forth. One party wants to cut down on food stamps, eligibilities, and so on and so forth, and yet again, the top 10% of the people in this country are getting 80% of the wealth, 80% of the income. And I think this should have a concern to us, because, like I say, it's going to have major implications as this continues on. It just can't continue on this path, having more and more people having fewer resources. And that's where, again, your hospital has more people walking in with uninsured and so on. I mean, you can't afford insurance at a $9.67 an hour and maintain a place to live and so on and so forth.
So what are we supposed to do?
Well, I think when people like Grassley and Braley now wants to run for the Senate and that, I think we have to stand up and say, hey, look, folks, enough's enough. I mean, we've really got to get the word out to our U.S. officials. Enough's enough. You can't continue down selling out. I mean, and it's both parties. It's not one party or the other. It's both parties.
I agree with you. We've always, even budget time and when we do raises every year, you know, we always put that floor in, so, you know.
But with the Affordable Care Act and Hawkeye for families that are making less, and also you can get retroactive Title 19 for 3 years of medical expenses, for 3 months of medical expenses when there's a crisis. We do have programs through the Department of Human Services to help those people. It's just letting them know about it. And those of us that know, that go to public health, but those people don't come talk to you. And
That's all well and good, but I don't know if there's that many people that wanna go over to the county social services and knock on the door and ask for help. They
You
would
don't
rather.
have to anymore. You do it all online and nobody, you don't have to talk to anyone.
No, but still, people are proud.
Right,
A lot
and
of
they
our
are, I
people
mean,
proud.
they would rather earn a living wage and pay for it than out of their own pocket than to be looking for this help, you know, but I'm not saying that the help is wrong, I
But
think
it's like it's in a crisis situation. And Hawkeye and those
Right.
type things are ongoing, and they understand that kids need insurance, and it's available out there. You just have to let people know about it, because it is a problem. And we recognize that they're trying to help with it, and you can get on your feet and graduate out of those systems, because they check every year, but it's a peace of mind to families to know that they have the insurance. We just have to let them know it's there. That they're not gonna get really sick and go to the ER because they've been sick for 5 days, when the rest of us would have gone to the doctor and got medication. But the child got so sick over the weekend or whatever that they couldn't go to the doctor, so they're going to ER and getting a $500 bill versus, well, office calls $100 plus
Lucky
medication.
it's 500,
Yeah.
not 1,000.
But an office call is 150 plus your medicine. So, you know, that type of stuff, the parents not going for services for their child or themselves because they're afraid of the huge cost, whereas they could get a smaller cost service. We just need to let them know about it.
Well, and one of the things that's really been bothering me is a lot of the stuff that you may run into or receive on the internet again. I mean, basically, and it comes from the super rich, really, trying to knock the food stamp, trying to knock all of this stuff. And they really want to divert attention from themselves, their greed, and try to get us to be on this other, and like you say, a lot of these people, they want to earn a decent wage. It was shown last night, 2 different times, where, I think it was in Ohio, a Walmart store, Walmart themselves put up a basket asking their customers to donate to help the Walmart employees that couldn't afford Thanksgiving. Now, what in the hell is going on when the store can't even pay a decent wage to their employees, and then they have to ask the customers yet to, I mean, this country's going the wrong
And there's probably
direction.
people throwing money in.
This country's going the wrong direction.
No, I agree, Stan, I mean, where's your middle class? It's gone.
It's gone.
You know, it used to be out there, you know, a person could make a living playing, you know, working for, well, just for instance, they used to, I think of the Warner Brothers, I mean, not to mention names or anything like that, but the trades, there used to be, you made a living wage, you know, laying carpet or laying block and brick and, you
Yeah.
know, well, just talking to the architects on this thing, there's nobody out there that lays brick anymore, you know, on a large scale, I mean, you know what I mean? And then, and it's all gone to, everything had to go to a bigger, they work for a bigger company here, and it's just, I don't know. It's just, I don't know what's going on. I agree with you, I mean, it's, people used to make a living selling shoes. Now you can't make a living hardly selling shoes. I mean, some people do, I shouldn't say that, but I mean, I can remember when this town had probably 3 shoe stores, you know. Now we got the one, and, but then the internet does a lot of that, because a lot of people buy stuff on the internet. You know, it's,
But I mean, it's going to affect counties more and more as time progresses. I mean, that's just something that we have to keep aware of, so.
yeah.
Manure management plan update.
You know, one from Christensen Farms and Feedlots, section 20 of Cedar East in Floyd. They're right on the Mitchell Line Street.
So-
They made a change just using a manure analysis for determining application rates when applying manure.
So noted. Item C, I had an item C. Apparently.
That wasn't added to the agenda.
Well, just a discussion.
Okay.
Apparently, they want to have the Christmas tree lighted one more time this year at Tupelo. It's up to you, Bull.
Decision has been made.
Uh-huh.
Decision was made.
Okay, what was it?
No.
Okay. Just curious. I mean, that's your decision. It's your. Talking to Barb this morning, one of the things that was brought up apparently at the convention this fall was this tax thing with the commercial taxes getting, reduced. There is no reimbursement on the railroad share. And so, we do have substantial amounts of railroad track going through the county, and they do pay a good share of property taxes. And so Barb said that will not get reimbursed. So it's one of those good things, again, that they keep explaining how this is all revenue neutral, except the taxpayers of the county will have to make up that difference on that portion.
In the supervisors meeting, they said it's only, the money coming back is for 3 years to the legislature, and the Department of Revenue State lady said, when asked, what do you do after that? She goes, well, if it's not approved by the legislature, then I'm sure it'll go away. And she meant the whole thing, but we all know the rollback will still stay, we just won't get the money back, so.
Yep.
That was,
So that's another thing to keep in mind. So when our local legislators come around next year wanting to run for re-election, we might as well ask how they voted on this and why they exempted the railroads.
And what their plan was going forward.
And the railroads aren't gonna build any more track just because they got a reduction in taxes. I mean, that was a giveaway again to the super rich, is all it boiled down to. Now that I'm off my soapbox, anything
I
else?
agree with you on that. I mean, it's.
Yes, sir, Mr. Huffman.
I'd like 2 comments. One is I've been passing these out to the schools, to the appropriate level, activity books on preparedness. Pardon me? And the problem that I'm having is that I ordered these and I can only order so many at a time. And so I said, well, I want some from Mitchell County and I want some from Worth County. Well, I used my same name. Oh, we can't do that. So then we had the government shutdown. So I'm way behind on getting coloring books and that. And I have spoke to the principals of the schools. I haven't got to all of them yet. And getting their okay to leave these at the school. So, but with that, we as Mitchell County have to get to our people, and I plan on getting to every city and saying, FEMA money's gonna run out in a few years. We better start getting prepared and take care of ourselves. As soon as the phone rings, we can't jump. And we gotta start with the young ones and get them educated, because the old ones won't listen or can't hear. Huh?
Speak for somebody else, I can hear real well, and my mind is working good.
On plan. That's all that I have, but that's one of the things that I'm planning on doing.
Anything else for the good of the cause?
Thanks, Greg, for the use of your room.
Yeah, you got a lot of information this morning.
we will be getting a list from the Historical Society of the items they wanted from their walkthrough in the courthouse. We did that yesterday.
Okay.
Yeah, I'll clean up that.
We did some catch and carry with loose items. We have already taken them to the museum.
Okay. And thank you both for going on that, whatever.
And I have my waiver form if you want that, but that's signed.
Will there be any, when people want to buy or have the lumber from the trees reserved for them, is there any cost to that?
They probably have to take it up with the tree service people.
Yep,
Because I'm
it's
sure
actually-
they look at selling those.
Well, I think that would be a good, you know.
It belongs now to Roger, and so if he wants
Are we gonna let people walk through and buy items? I've had a couple people inquire as far as bricks.
I don't think we should let anybody walk through.
Okay.
Didn't Don say something about
Right.
Right, but Don did say something about
When you watch your contractors on a prior.
if we want a pallet of bricks for people to have, we can specify that and then set aside a pallet of bricks.
I've had people ask about purchasing bricks.
You sure?
There's not a whole, I mean, there's nice old woodwork.
Give no brick, you can make a brick oven.
Pizza oven outside.
That's what I was
I would
thinking.
love, that would be that.
I'll send it to you, this information on the hospital thing.
They have drawings and I have that.
You can just set down, like a Julie's counter, I'll take it from there.
I never heard
You
of
bet.
that.
I've got
I got asked
down
them.
on that flash